So I just did the H. pylori test, and that was by far like the most painful. That was some of the most pain I've ever been in. Like, I had to do a test where they like breathe the air that's in my body. So I had to like breathe into a bag and then drink this drink and then wait 15 minutes and then breathe into the bag again. But during that 15 minutes that I was waiting, the drink that they had me drink, I didn't know what it was, but I drank it, and then my boyfriend just looked it up, and it was like literally a citrus juice. And I have acid in my stomach, and I just drank a full thing of acid, and it was literally so painful. I couldn't stop crying. Like, by the time it was like 8 minutes in, like, I didn't know how much longer I could wait. I had to tell them, like, I had to go in there just so we could like get the second part of the test done, like as soon as I was hitting the 15-minute mark. It was so bad, so painful. As soon as I got in the car, I just popped 2 Tums, and I'm also drinking some ginger kombucha, which has been saving my life, my saving grace right here.
You have anything to say to your fans?
Oh my God. So after that H. pylori test, and I was like in some of the worst pain I've ever been in my entire life, we pretty much got home, and I did everything I could to just like manage the pain. We put on Netflix, and I slept for like 13, 14 hours or something. I feel like I literally just like slept the pain away. I woke up a couple times in between. Luckily it was only like 3 times in the night, because now that I have the H. pylori test done, now I get to go back to having my Tums, my omeprazole, and take like my medication that I usually take for this pain. So it's slowly getting a little bit better. I feel like I'm like still like in this like almost like a recovery mode. Like, I feel like I'm in recovery right now. I'm just in this like 3rd dimension, just trying to like get through this pain. But it is Saturday night, tomorrow is Sunday, so I guess our update is that my surgeon is actually out of town right now, and I'm gonna be able to get an update from what he wants to do with me on Monday. So we're just kind of waiting for an answer for now, so we'll see. Alright, you guys, so we just got to CVS. I am picking up a brand new medication. So get this, back in November when I was at the bariatric retreat, I met Dr. Russo, and Bree, you guys know Bree, she actually contacted him and let him know about all this pain that I'm in and how I haven't exactly been able to talk to any WLS specialists. So she got in touch with him, and he is the one that prescribed me this medication. It's supposed to help with the ulcers, so I'm going to take this. I'm going to start taking it. I've never been prescribed this. No one has ever talked to me about it before, and apparently it's like the most popular one. So I'm going to go get it, and I'll show you guys what it looks like. And you guys want to know what I do every time I go to CVS? I check out the nails. Because right now, this week, being all hospitalized and in pain, I've been busted, crusted, and dusted. It's time to get some new Kiss Gel nails. Oh my gosh, I am overwhelmed. This is like the biggest Kiss Gel nail selection I have ever seen at a CVS. Pro tip for any of you guys, I love long nails, like I love them so much, but lately I've been just finding it most comfortable to do the medium, and you can always tell which length they are because it has the size at the top corner. And to be honest, the ones I've been wearing lately are any of these ones, the Impress, the ones that have the sticker underneath and then they just stick on your nail with an actual sticker. I never thought that they would work because it's not glue, and they work amazing. Like, they literally will last you so long. I've had this set on since before my birthday, and now I'm barely getting a new pack, so I don't even know which ones to choose. I feel like I'm gonna end up stocking up again. Okay, so we just picked up the Strikrofate, and now that I'm looking at the name of it, I saw a lot of you guys recommend this medication on Instagram and in the comments of one of my previous videos about this entire process. So I am super excited to actually be trying something that was really highly recommended by all of you guys and recommended by a really, really trusted WLS doctor. So I'll show you guys what it looks like. They are big. This bottle is heavy. This is like a dense pill. Oh my gosh. It fell into the black abyss, but hold on, I could get it. You have to show it on the edge of glory.
Oh, it's right there.
Oh my gosh, it's literally right there.
I don't know. Did it fall?
Oh my gosh.
No.
I can't believe I just lost the first pill. I'm not really that irresponsible. A little excitable, sure.
What were you grabbing with your nails?
I don't really want to bring attention to it. But I am literally busted, crusted, and dusted. Do you know how hard it is to handle things when you're missing a part of who you are? Part of me is just fake.
I think the nails are getting to your head.
Are we still recording?
Yeah.
Okay. So this is what it looks like. It's pretty big in size. These pills are pretty dense. They're heavy. And reading the instructions on the bag, you take 1 tablet by mouth 4 times a day. Oh my gosh, that's a commitment. Take medication on an empty stomach 1 hour before, 2 to 3 hours after a meal. Take this drug 1 hour before or 1 hour after antacids, iron, vitamins, minerals. Take or use this exactly as directed. Do not skip doses or discontinue. All right, guys, I'm excited. This could be something that works really well for me. Like, people were really swearing by this medication, so I'm excited. We are on the road to getting better, guys. We're getting there. I'm feeling better, guys. I'm feeling so much better today. It is Sunday. I have been in bed all week long. I've been home in California for the last like 4 days, getting my appointments done, talking to so many doctors, talking to so many of you guys, trying to get my health first. I've been trying really hard to give you guys like little updates here and there, but between all of the different pain medication I've been on and how crazy my sleep schedule has been because of all the different medications I've been doing, I feel like I've been living in a third dimension. I honestly cannot stop saying that. I'm having a really hard time remembering what day it is, what time it is. I have just been really going through the motions of playing the pain management game for 2 weeks, but the last 6 days especially have been some of the worst, the most painful moments and experiences I've ever had. And yeah, I'm just really glad that we are finally starting to get it all taken care of. If you guys have been following along this little journey, this is the update of figuring out what's wrong with my stomach. We recently found, okay, not exactly recently, we're just recently readdressing the problem. We found a few years back a perforation or an ulcer in my accessory stomach. So there is a whirling effect of acid eating away the lining of my accessory stomach, which I have after having gastric bypass weight loss surgery. And we just basically need to figure out what to do in order to cure that because it has been so painful, and the only thing that kind of helps subside that pain is popping Tums, anything with ginger, ginger ale, ginger chews, ginger tea, anything, Tylenol, edibles, anything like that has been what I've been doing in order to manage the pain. And I am just hoping that we can now get down to the bottom of it and figure out how to cure this rather than just manage the pain. So that's where we're at. I just did my H. pylori test. Our first step of doing all of this, because we're going through insurance, was to get my blood work done. So we've done the blood work. I had to do the H. pylori test. You guys, I don't know if we're gonna end up showing it because it was a really, really rough update and I couldn't really speak without crying because I had never been in so much pain in my life. But after the blood work, it was time to do the H. pylori test. And if you've ever done that before, you breathe into a bag, and it's kind of like a Capri Sun. So you breathe into it, and there's a little straw, and you breathe into it. It's gonna test the air that you exhale. You're gonna then drink a little concoction that they make up for you, and just like any other hospital drink, they try to usually make it a little fruity so it's not horrible to taste. So then you drink that, and then you wait 15 minutes, and then you breathe into a new bag, and then they test that air for the H. pylori bacteria. What I didn't know with this H. pylori test, and I've done this test before because it was part of the prerequisite appointments that we had to do for gastric bypass surgery, I didn't know that the drink that I drank in between the 2 tests was just pure acid. It was like a citrus acid drink. So when I drank it, the first couple minutes was fine. I didn't notice any difference. And then, you know, the guy who was doing the test for me, he said, all right, just go wait in your car, come back in 15 minutes. And within like, what, 4 or 5 minutes, babe?
Yeah,
5 minutes.
It was like, within like 2 or 3 minutes, he just started like grunting, and I was like, what's wrong? And
Oh yeah,
like,
it started with a grunt.
do we need to go to like ER right now? Like,
You guys,
what?
I didn't know what was happening. It literally felt like someone just kind of like opened up my body and was like, let's just light a match in here and see how bad it burns really quick. Just really quick. Let's just see how bad it burns. It was so bad, you guys. Like, when I tell you, it felt like my entire stomach was on fire. That's what it felt like. And when I did this test years and years ago, back in 2017, when I was doing the prerequisites for my weight loss surgery, I never experienced any issues because I didn't have any issues with H. pylori or ulcers or perforations in my stomach. I know we have a microphone, but I'm hoping that this isn't too loud. Anyways.
Those darn planes.
So yeah, a couple years ago when I took the test, there was nothing wrong with it. I didn't realize that it was even it could be a painful test because I didn't have the issue back then. So now this time going around, I did the H. pylori test. We're waiting in the car. I'm just trying to let the 15 minutes pass by. A couple minutes in, I'm just like moaning and groaning, like, and it's getting a little hard to breathe. And you guys know I told you it's like that shallow breath that I'm dealing with. It's like that shallow breathing when I'm in these like pain spells. It's like I can't inhale all the way. It's just like, and then I was just like, oh my gosh, like, does it feel better to curl forward? Should I recline and go back? No, okay, I remember reading stay elevated. Should I get out of the car and stand up? At this point, 6 to 8 minutes in, I'm pretty much on the ground in the parking lot. I'm in public, out loud, screaming, moaning and groaning, crying. I'm the type of person where I don't like to cause a scene in public. Yes, I know I can be a little large and in charge. I got a big personality. You'll probably notice if I walk in because it's kind of loud sometimes. I get that. But when it comes to like public situations like being in a store, obviously I'm not trying to cause a scene, and I'm out here crying in the middle of nowhere. Anyone that knows me, that's like my biggest fear, is to just be like out of control like that in public. Like, I'm not even the type of person, I don't like to be on a phone call out in public because I don't want to be like putting myself like on blast like that. Like, I just get embarrassed with random stuff like that, like social stuff. And here I was just having a major meltdown, just in pain, screaming, should I go to the ER? Should I even finish this test right now? Should we just drive to the ER? You guys, it was so bad. That was the most pain I've probably ever been in my life. Like, I've never cried from being in pain like that before. I've been through the gastric bypass recovery. I've been through the gallbladder recovery, tummy tuck recovery, boob job recovery twice. This, nothing else is compared. And what the guy told me was that since I did react this way to the test, it's probably a good thing that we'll probably be able to get some answers from this test. So that's the first thing off the checklist. After that, I did talk to my primary doctor, the one who is starting all of these tests and getting me going through insurance. And when I told her that I was at a level 10 pain without being on this medication, waiting to just ride out these 2 weeks, getting all the medication out of my bloodstream, I told her, like, it's been a really hard 2 weeks. I've been trying really hard to be really good and not reach for any of the medication that's going to ruin the blood work. So I told her I was going to be strong and just really ride out these next 2 weeks and just try to manage the pain as best as I can until we get this blood work done. So I told her as soon as I had that blood work appointment done, I called her and let her know, all right, we're going to be ready for the next step after Saturday. So let me know what our next move is. And then she was just like, okay, well, if the pain is actually that bad, then you should just go to the ER. So then I felt really discouraged because I felt like she just kind of rode me off to the ER. You know what I mean? So now I'm thinking, I am a WLS patient. I can't just go to the ER, and if this is a surgical emergency, if I do need to get surgery done, if I need to go get my gastric bypass reversed, if we got to do some patchwork, whatever it is, I am a WLS patient. I am special package deal. Okay, like, I need to have a special surgeon. So I don't feel comfortable going to our ER here in Ventura just to go get general surgeon, just to go have a general surgeon work on me.
Because they're not specialized in this type of surgery. You want someone that specializes in it.
Yes, so what I'm trying to do now is, since my doctor kind of rode me off to the ER, I am now deciding I'm going to talk to Dr. Billy, my WLS surgeon, and he is incredible. He is like one of the most reputable WLS surgeons. Like, he's like the type of WLS surgeon, like, where, like, it's a flex to be able to say that Dr. Billy is my surgeon, okay? Like, he is amazing. He's very well known. I'm very lucky to have him as my surgeon. It's literally just such a blessing. But anyways, I'm gonna wait for him to come back from his vacation. He comes back home tonight. He will be back in the office tomorrow morning. I'm gonna call or go in. I'm probably gonna call because I'm trying to be respectful with COVID stuff, you know, it's like you're trying to do phone appointments and everything. So I'll probably call first thing in the morning, 9 a.m. when they open, and I'm just gonna pick his brain because I haven't talked to him about my issues since October of 2020, and that's when I was just given the omeprazole. So the last thing we left off with him was, all right, we found it, we took the pictures with the gastroendoscopy, here's your omeprazole, that should help ease the pain. But I have been living in pain every day since then, so it helps a little bit. The Tums, I find, help a little bit more. But I want to get down to the issue of this. I want to be healthy. I want to feel fine. I don't want to be able to get on with my daily life as soon as I pop this, that, and the other just to feel okay again. So that's what we're doing. I'm gonna wait for Dr. Billy to come here, figure out what the next step is, and then if I need to be here in California in town for any surgeries, if he's like, let's just go to surgery, then I'm here. And if it's gonna be like experimenting with new medication, which I'm also open to, then I can go back home to Arizona and then just get stuff going. So that's the update. I'm sorry, I know sometimes I'm not the best at like quick versions, but I'm just a detailed oriented person. So if you're here the YouTube and that's what you want, the full tea, then that's what you're gonna get here. I'm just so glad, you guys, I'm able to talk like my normal self again. Babe, this is the first day I'm acting normal again, right?
Yeah.
In like 2 weeks.
Yeah. You've been in excruciating pain like every single day, and like you've been having to take like Tylenol. You can't take any Tums, so the only thing you can take is like just Tylenol.
Yeah.
Like to ease it, and that eventually that doesn't do anything because you're taking it throughout the day, and like you're just getting used to like the effects of that, and the pain just like stays.
Yeah. So yeah, lots of medicine. As far as food and everything that I've been doing to just kind of ease the acid, I put up a little question box asking for recommendations from you guys on Instagram, and I got so much good feedback. I will be sharing all of the feedback that everyone gave me on this video because I think it's helpful information. And if you're watching this series, it's probably because you are dealing with something similar, or you're nervous that you might deal with something similar. So there is something that everyone can learn from. I'm just hoping that by putting it out there that we can all just learn and grow together and get this stuff figured out, because I know I'm not the only one dealing with it, and it's something that's very common. So let's just get down to the root of this. I'm so thankful for the support that you guys show me literally every single day, and it's not even just towards my weight loss journey. Like, you guys support me on every level, even the people who are messaging me like, I'm the middleman for my person too. I have that on my heart all the time too. This is just like my place. This is my space, me and you guys. And I need you guys so much. You guys have no idea. I'm so thankful for all of your support in every aspect of my life. You guys support me, and I don't deserve you, but you have to know how grateful I am. So that's our update for now. I will be here on YouTube giving you guys updates as soon as I get them. But that's all for now. Thanks for watching.